Section 2.4.1 Specifications. Responsibility for complying with this section lies with manufacturers and importers, and, if applicable, packagers and distributors. The onus for the GMPs is on manufacturers and importers, but the responsibility may be undertaken by packagers and distributors, depending on contractual agreements. The requirement here is to ensure that every NHP made available for sale complies with the specifications. We've already looked at the definition of sale, so now let's look more closely at the definition of specification. A specification is a detailed description of an NHP that includes the NHP's properties and qualities, including identity, potency and purity, the methods used to test the NHP, and the tolerance limits of those properties and qualities. For the purposes of the NHP GMP specifications, refer to those specs that were submitted to and approved by the NHPD during the product licensing process. You cannot have two sets of specifications, one that you submitted to the NHPD and one that you or your foreign manufacturer are going to use for testing. If your contract or foreign manufacturer wants to do testing above and beyond those approved by the NHPD, that is acceptable, as long as the approved specifications are met. Now, here's a scenario with which some of you may be able to relate. In the first frame, Dilbert says to his manager, "My tests prove our product is defective. Customers expect delivery tomorrow." The manager responds, "Our corporate philosophy is quality is our primary goal." "So," says Dilbert, "you want me to delay shipment until we fix the problem?" "No," says the manager. "I want you to ship now so we can book the revenue." "Gosh," says Dilbert, "that's the opposite of our philosophy." "Now you know," says the manager, "why there aren't any rich philosophers." You really have to work in QA to appreciate that cartoon, but it does demonstrate the tension that can sometimes exist between QA and sales. What are your responsibilities when it comes to specifications? You must develop and implement specifications for all finished products. We're not going to discuss specific testing requirements here, as that would be more suited to a product licensing training session. However, we would like to emphasize the remaining points, which are as follows. You must confirm that all test methods provide accurate, consistent, and precise results. The importance of this cannot be overemphasized. If you're not using methods that are suitably accurate and precise, you could be releasing product that is really out of spec. The converse side to this, if you're not using test methods that are sufficiently accurate or precise, you could be withholding the release of product that's perfectly fine, but you received a test result suggesting that it was out of specification. Note that accuracy and precision are not the same. A method can be precise, but not accurate, and vice versa. Note also that validation as per ICH is recommended, but not required. It is advised and recommended that you validate your text methods as per ICH, bearing in mind that validation can be very expensive. As a minimum, however, you should have some sense as to how accurate and precise your method is, and have some documentation in place to support it. What does all this mean for importers? Importers may rely fully on their supplier's certificate of analysis to demonstrate full testing and compliance with specifications. The importer must review the certificate of analysis from the foreign vendor for every lot. The certificate of analysis must report the tests that were done, the methods used, and the actual test results. They should not simply say pass or fail if the specification calls for a numerical result. When relying on suppliers' C of A's, importers are encouraged but not required to implement a confirmatory testing program. This will involve fully testing the first lot of product received against specifications, including any identity testing. Just a word on identity testing. This doesn't mean that you simply look at the label to see if the right name is there. It may call for a proper laboratory test, unless of course the organoleptic properties of the product are such that you can uniquely identify the product simply on that basis. For example, by looking simply at the physical appearance, the taste, the odor, etc. However, if you're dealing with a round tablet or a standard tablet capsule, it wouldn't be good enough to simply look at it. There are thousands of tablets and similar products out there, and you need a test that will sufficiently identify and distinguish that particular product. Second, ensuring that transportation and storage conditions do not adversely affect product quality. Relying on the manufacturer's certificate of analysis only makes sense if you can ensure that the product retains its quality during the trip. Third, conducting full confirmatory testing against specification on at least one lot per dosage form, per supplier, per year. There seems to be a lot of confusion concerning this particular point. So, for example, say you import 7 products in capsule form and 3 products in tablet form, all from the same manufacturer. You wouldn't test all 10 products annually. Instead, you would pick one of the capsule products and one of the tablet products and conduct annual confirmatory testing on those. Ideally, such testing should be rotated. So, from among those 7 capsule products, you would choose one to do the first annual test. Then, thereafter, you would switch to a different product for each subsequent annual confirmatory test. We'll now consider some of the reasons for lack of compliance when it comes to testing for specification. One of them is simply ignorance of the GMPs. This is particularly true of tiny operators who just aren't aware of the GMP requirements. Some of these other remaining reasons, however, may hit closer to home. Often, it's unclear as to who is obligated to do the testing. Frequently, when asked to see certificates of analysis, we would be told to speak to the manufacturer. The manufacturer will say, "It's not my responsibility, speak to the importer." The importer will say, "It's not my responsibility, speak to the product license holder." Sometimes, it's unclear as to who will pay for the testing. Contracts are drawn up with manufacturers, outlining the costs for producing the product, but testing costs are not factored into this. Sometimes, it's unclear as to what tests must be performed. Again, it must be the finished product specifications, approved by the NNHPD. Make sure you communicate this to your contract manufacturer or your contract laboratory. Another reason is that the test methodologies are often not well defined or detailed enough. For example, they'll often say HPLC. This, however, does not tell you how to prepare the sample, what detector to use, what column to use, or how to interpret the results. This must all be detailed in a written procedure. Sometimes, such procedures can be lifted out of a pharmacopoeia monograph or some other written standard, but often there is no monograph, especially for combination products, and some method development may be needed. Another reason for lack of compliance is lack of proper change control. The specifications can change, or the formulation can change, and this has not been passed on to the right people, so the wrong testing is undertaken. For example, there was a manufacturing facility where someone decided it would be a good idea to order a new type of packaging material. This new material was fancy transparent bottles, and they thought the product would look very nice in these new containers. Indeed, the product did look very nice in those bottles, but there was a problem. The particular medicinal active ingredient in the product was sensitive to light. Nobody had conferred with QA to find out if such a change was acceptable. They simply went out and ordered the bottles. It was then decided to do a test to see exactly how this would affect the product. So, it was put in the light and then tested after 3 days. The active ingredient was virtually gone. It had completely degraded in the light. What are some ways to avoid lack of compliance? Well, first you should ensure that the staff is educated with respect to the need to meet specification, and this includes senior management, purchasing, and sales. Senior management's position will set the tone for the rest of the company. It's key to have senior management buy into the process. Having written contracts or technical agreements in place stipulating the party responsible for performing the tests. As mentioned, the NNHPD is now asking to see copies of technical agreements between the companies more and more during the site licensing review process. If they sense there's an ambiguity as to who is responsible for testing or other activities, this will result in a deficiency notice. Ensure that QA from all parties are involved in signing off on the specifications. Again, the manufacturer may be making the same product for other markets besides Canada and may not recognize that your specifications are unique. Some other ways of avoiding lack of compliance is to ensure that your laboratories have comprehensive test methods in place. Sometimes, labs won't want to share the details with you because these methods are considered confidential. But at the very least, you should get them to attest that they have these methods in place and that they are sufficiently accurate and precise. You should ensure that tight change control procedures are in place that include QA pre-approval of all changes to specs. notification of all relevant parties, all departments and contractors, and the filing of product license amendments. Bear in mind, the changes to specification require that a product license amendment be filed, and that change cannot be implemented until approved by the NNHPD. Whenever possible, have all of the above in place before a purchase order is placed or accepted. That is, while everyone still has a vested interest and can bring pressure to bear. Once purchasing has secured a good deal and the salespeople have their commission, they tend to lose interest fast.